7:39 Saturday morning. Welcome back to KVUE Weekend Daybreak. There has been a dramatic increase in the use of stem cells and platelet-rich plasma, or PRP injections. They're used for treating pain as an alternative to pain meds or surgery. So how do these treatments work, and why is there so much demand for them? Well, with us this morning today is Dr. John McDonald. He is the orthopedic surgeon with Texas Orthopedics. Good morning and welcome. So tell us what this is. We've heard a lot about these plasma injections for hair growth, for facials, and now for pain management.
So basically, platelet-rich plasma is your blood spun down in a centrifuge to get the platelet layer out. These cells have growth factors in them that help incite new blood vessel ingrowth, to help heal tendons when they're injected there, sometimes with irritation to the tendon. And they also allow new cells to come into the area to help heal and regenerate tissue.
And so we're seeing, a lot of NFL football players using this?
So over the last 5 to 7 years, there's been a dramatic increase in professional athletes using PRP and stem cells to try to heal faster and get over overuse injuries and help with cartilage damage in different joints.
What's the research showing?
Well, it's really hard to regrow cartilage. Cartilage is the white part that caps the end of the bone and protects it. And when that wears down, we call that arthritis. And that's the real goal of treatment of joint pain, is to try to regrow cartilage when it's breaking down. And we don't have the magic bullet yet, or the real answer yet, but PRP has been injected into joints, and it can calm down inflammation and improve pain.
Okay, and that's the rise in popularity, but there's a danger to that, right? Now everyone wants to do it, and not everyone can do it, medically speaking.
Well, it's not for everybody, and it's certainly not the end-all be-all. But there's some new science that shows that if you inject PRP into an arthritic joint, that it can improve pain. And there's certain formulations. The problem is that PRP is not all the same. There's different ways to obtain it from your blood, and different kits, and different ways to centrifuge it to get the platelet layer out. And those are all not the same. Because of that, the way that it works, or the way that it improves pain, is not always the same.
And we should really rely on the experts to do this, right? We should rely on doctors. Are there more pop-up facilities kind of doing the same thing? What's the warning here?
Well, there are a lot of different ways to accomplish this goal and get pain relief from biologics or stem cells or PRP. But I think it's important to see a board-certified orthopedic surgeon when you're evaluating your joint pain, in order to try to get a full diagnosis, because although you may be a candidate and try to avoid surgery and certainly pain medication, and this is a nice alternative to that, it doesn't work for everybody.
Is this something that you guys do at Texas Orthopedics?
It is.
Okay, and so how many, sessions does a patient have to go through before they see success?
Well, it's a great question. The short answer is nobody really knows, because the data is in its infancy and the evidence is in its infancy. But the most recent scientific research from the American Journal of Sports Medicine this year showed that 3 injections of PRP a week apart have improved pain better than some of our other treatment options, including hyaluronic acid, which is that lubricant injection you probably have heard a lot about, or steroid injections, which have been around for 50 years in orthopedics.
Anything we can do to put a dent in this opioid crisis, right? To give people another alternative. But the bad news is this covered by insurance?
It's unfortunately not covered by insurance, and so it can be quite pricey. And
how much are we talking about for
it depends. Usually it's between $500 and $650 an injection, and it depends on the joint and how much blood needs to be taken and the cost of the kit in order to obtain it.
All right. Well, Dr. McDonald, thank you so much for coming on our show to talk about this. We appreciate it. And for more information about this study and overuse injuries, or actually about plasma injections, you can visit the links section of our website, kvue.com.